It started about just over 5 years ago. When I was riding, I used to get a lot of clicking in my hip. My hip would catch and wouldn't open outwards, which when you're on a horse is quite a inconvenience. The pain was getting a lot worse, and it was also starting to happen when I was walking as well. I used to take strong painkillers at least 3 times a day. I couldn't ride without taking extra painkillers, and if I was competing, which I do quite regularly, then I would have to take extra painkillers on top of that. So I was basically living on painkillers so that I could do what I loved.
Nikola is a great patient. She's a classic who is very, very active. Horse riding is her passion, and she spends a lot of time outdoors. Quality of her life was impaired because of groin pain, a lot of clicking, and her hip was unstable. Now, she had lots of injuries on the hip and difficult to pin down what exact injury, but she had one significant injury when we reckon she damaged the ligamentum teres, which contributed to the hip instability. Now, ligamentum teres is a structure that is between ball and socket of the hip joint in a very snug space, and it acts as a joint stabilizer. It gives brain the sensation where the joint is, very much like the cruciate ligament in the knee. And after a due consultation and a long process of rehab, we decided that rather than just clean up the hip and debride that ligamentum, she'll do better with a ligamentum teres reconstruction.
What we decided was I needed to be as fit as possible before the operation, which would hopefully make my recovery faster. So I had physio every week. I was in the gym 3 or 4 times a week, swimming, on the bike, classes, to try and get myself as fit as possible.
When somebody has been referred for investigation and possible surgery, the most important thing is to put them at ease and just allow them not to worry about the whole process, while recognising it's actually going to be a very tough process for them. Everybody will have different goals, different motivations to get back to where they need to be. There's absolutely no point in being dictatorial about it. We need to provide some motivation for them and a little bit of focus as to how they need to do it. But actually, a good 80–90% comes from the patient themselves.
I could start to do things very quickly. Within a few days, I was feeling a lot better. I think the pain really eased off after about 10 days, and the difference, I could feel a difference instantly. I knew that something was working. I had my first physio 7 days after the operation, and that just started gently with the movement and making sure my range of movement was good. I then started swimming after about 3 weeks. Just gentle and just front crawl legs, no breaststroke legs at all. I've been using the treadmill and the running machine. I can now use the rower and the bousson, and I could get back on again after 16 weeks riding. So I've been trying to fit everything in, and it's all been going really well. But from the moment that I got on him, I've had no pain at all.
And Nikola Penny, she is a great patient because we asked her that you need to get strength back in the hip before we operate. She did that in 3 to 4 weeks. Her musculature was in a lot better shape. And then afterwards, she put in a very, very hard work. I had set herself a target of returning to horse riding and all sorts of sport around 5 to 6 month mark. And she hit it at 3 month mark in the saddle, and now at 5 months she's already been riding for a month and a half or so. That is exceptional, but that depends that she had a structured rehab with Alistair, who was a physiotherapist, and he knew exactly what he's doing, and a milestone approach. Rather than go by number of weeks, if the patient hits the milestones, we move her up. And because she was putting a lot of hard work in, not doing too much, just appropriate amount. So Nikola is a delightful patient. She has made us all very, very happy because she has hit all the milestones at the right time and then has progressed to full function.
The most important aspect of the rehabilitation is the information that we get back from Mr. Bargeois. When we get phone calls, letters, emails, so the information is absolutely complete. Without that, we can't do a decent job. From our point of view, we've been very much getting her back on the horse again, but she's always responded superbly. She's never lost interest or hope in getting back on the horse, and her determination has just been fantastic.
I didn't think I would get back to being pain-free. I think I'd forgotten what being pain-free was like. the operation now, it's just made such a massive difference. I get on my horse and I don't hurt, and I jump off my horse and it doesn't hurt. Whereas before, I would get off after riding and I couldn't bounce on my feet. I was almost on my knees. It was just so painful. But no, it's been brilliant.